Welcome, everyone. So, if you don't know who I am, I'm Dr. Gretchen. I'm a physical therapist in the United States and a multiple sclerosis certified specialist. So, everything that I teach is based on research and neuroplasticity and functional exercise. You will likely find that when you have an MS specific approach to exercise, it's very different from an orthopedic approach. And today, what we're going to be talking about is our core. Our core is probably the most important area of our body because having a strong core often means that all forms of movement is easier. So, we're going to dive into what the core is, why it's important, and actually some core exercises too. So if you're up for it, you can do those exercises right along with me, or you can just write them down, do them in the future whenever you think of it. So we're going to first review the core basics and then core and posture exercises. Posture is often something that people think about as a different category from our core. When we think of posture, we more so think of our upper body, our chest, our back, and how much we're rounded, but it coincides with the core very much so. And so it's important that we talk about both together. And oftentimes, the better your posture is, the better core strength you can have as well. So we're going to talk about both of those today. So what is the core? So often when I ask people, what's the core? Everyone says it's your abs, your abdominals. And yes, you're absolutely correct, but it's much more than that. It's also your side muscles, your back muscles, and your hip muscles. All of these are your core, which means that if you have really great strength in one of these areas, but not the other, you can still feel unbalanced, or you can still have low back pain. Your mobility will still be affected. Again, 9 times out of 10, when I treated those patients who came to me for low back pain, a lot of them, I shouldn't say 9 times out of 10, but a lot of them were very strong. They were athletes, and I bet you they probably had 6-pack abs. But when I looked at their deepest abdominal layer, they had no strength there. When we looked at their hip strength, it was minimal. When we looked at their side and back muscle strength, it wasn't great. And so, yes, you can have strength in certain areas, but it's really the whole package that makes the biggest difference. So we're going to be focusing on that today as well. So what is posture? Posture is holding your body erect against gravity in standing, sitting, or walking. And you can have dynamic posture or static posture. Static is what I'm doing right now, where I'm not really moving a whole lot. I might be, shifting my shoulders here and there to pronunciate words, but I'm pretty much staying in one position. So this is static posture. Whereas dynamic posture is keeping good posture up nice and tall as I'm walking, as I'm moving. So dynamic really just means movement. So reaching like this, walking forward, backward, stepping to the side, that would be all dynamic posture. And it's important to know those differences because you can strengthen your muscles in a static way or dynamic or both. So obviously both is going to be great if you have the capacity to do so and the energy to do so. When we're talking about posture, it's important to understand what is required. And posture often requires, if not always, strength and flexibility in your neck muscles, your shoulder muscles, your abdominals, your hips, and your back. And it all depends on what your posture is like. So we're going to go into a few different examples, but just understanding that it requires both strengthening exercises and flexibility and stretching exercises will put you ahead. Like that's a number one thing to understand when you're working on better posture. So when we're thinking about better posture, what does that even mean when we're sitting or standing? So either one, sitting or standing, we know that poor posture often is rounded like this. So a lot of people think that better posture might mean this. And what you can't see, actually, let me back up so you can see fully what I'm doing. So we might think of poor posture as this, which is accurate. This is not great. And we think better posture means this. And this is not true. So right now, my back is really arched. And this is often what we do sitting or standing. If I'm standing, this would not be great. So we try to overcompensate and arch. And it feels like we're up tall. It feels like we're being as tall as we can, so this must be great. But that's not actually what good posture is. Good posture should not be overextending your lower back like that. That would just lead to more muscle imbalances, more low back pain. The way that I like to think about good posture, seated or standing, is to think of yourself almost like a puppet, and you have a string on the top of your head, and someone is pulling that string up. So you want to just be as tall as you can be without extending. So there's a happy medium. It's getting yourself up there, but without moving too much into that extension, because that often leads to more pain or imbalances. So when should we use posture and core in these exercises that we're about to do? Always. And I don't mean 24/7, but so often we only engage our core or have better posture when we're exercising, when we're thinking about it. And in reality, we should be implementing our posture exercises and our core exercises during almost every movement that we do. When we're younger, anywhere from, I would say maybe like 7 to 16 or so, it happens automatically. We don't even have to think about it. But as we get older, even MS aside, we tend to just forget what muscles to use. And if we don't turn them on by actively thinking about contracting them, then they're not going to work. So examples of this would be, before you get in or out of your car, tighten your core muscles. It has to be an active thought of tighten my core, brace these muscles. Getting in and out of bed, same idea. You would tighten your core muscles when you get in or out of bed. Maneuvering in your chair. So if you're reclined right now, before you even sit up tall, engage your belly muscles. Try to tighten those core muscles, sit up, and then scoot forward or backwards. Repositioning yourself when you're strengthening your core, especially. Putting socks, shoes, and pants on, walking, getting in and out of the shower, getting dressed, pushing a door open or pulling it closed. These are all moments where right before you do that activity, you can think to yourself, engage my core, and then do that thing. And engaging your core, honestly, can take anywhere from 0.5 seconds to 3 seconds tops. I want to touch on posture. So earlier I had said that in order to have great posture, not even great, just better posture, it requires strengthening and stretching. And so there's two most common posture imbalances that I see with my patients who have MS. So I'm going to demonstrate what those are and then share with you what muscles you would want to stretch and what muscles you would want to strengthen based on that posture. So the first one, I'm going to show you seated, and I'll also show standing as well. But the first one I just call rounded posture. So what that means is rounded. So you might be sitting like this right now, or maybe you know that this is your normal. So if you're sitting, it might look like this. If you're standing, with or without a mobility aid, it would look like this. So it's more of just rounded. So important muscles that you would want to work on in order to go from here to here would be a combination of stretching the front side of your body, your pec muscles mostly. So if I'm rounded and my shoulders are forward, these muscles right here get tighter and tighter and tighter. And they essentially will pull you forward into this position. So if we stretch these muscles out, that can automatically help improve your posture. My favorite way to do this is to get in a doorway, seated or standing. So if you picture me in a doorway right now, and the door frame is around me. You can put one arm on the door frame and lean forward. So from this side, it would look like this. Door frame, lean. And you should feel that stretch in the front area. You could also do both arms on the door frame and lean. You could also move your arms a little bit higher up on the door frame and lean, or lower down and lean. But you have your arms on a surface that will not move, and then you lean forward. So you're getting that stretch in here. You can also get that stretch in a similar way using your chair. So you'd want to scoot to one side of your chair, reach back for anywhere that you can reach. It could even be an armrest, and turn the other direction. And you should feel some type of stretch up here. And then you would do the same thing on the other side. Grab and reach. Or down here, doesn't matter where, but you want it that turn. So that would be stretching the front side. If you have really tight muscles here, one simple stretch could be lying down on your bed, on a couch, anything. Just lie down and put your arms out to the side. And if they stay up, that's a huge indicator that these muscles are so tight that you can't even relax your arms down on the floor. That's the stretching component. For this rounded posture, you'd stretch here with those stretches, and you would strengthen your upper back right between your shoulder blades. One simple exercise that we all can do, seated or standing, is to sit, ideally with your best posture, even if that is rounded, but sit with your best posture. Hands are facing up, elbows are in at 90 degrees, and you're going to squeeze your shoulder blades together and down. Almost like if you were wearing jeans, you want to get your shoulder blades to slide down into your jean pockets in your back. So this is what it looks like from the back. Squeeze and release. Squeeze. You're holding for about 2 or 3 seconds, release. Squeeze, and you're just squeezing those shoulder blades together. So that is a great exercise to help strengthen, so that once you have the flexibility here, you also have the strength to get into a better posture and stay up here. So those are 2 of my favorites. There are, of course, plenty others. The second posture technique that I notice, mostly in standing, but even in seated, is a hinging posture. So it's not necessarily rounding. Instead of rounding, it's hinged. So you're just forward. Your hips are more bent, if you will. If you're standing with or without a mobility aid, it often looks like this. So this is a completely separate type of posture that would not necessarily benefit from those exercises that we just did, because that focused more on our upper body. When you're like this, it's more of a hip tightness and weakness. So when you're like this, what we want to do is stretch the front. So we want to stretch our hip flexors. When these muscles are tight, it pulls you forward. So we want to stretch those muscles out. One simple way that we can do this is by lying on your stomach. Again, in bed or on a couch, just lying on your stomach gets your hips into a fully extended position. So that's one exercise you can do. Muscle tightness always wins over strength. So even if you have full strength, if these muscles are tight, you'll still be in this posture. So stretching those muscles out. Now the strengthening component, we'd want to strengthen the back side. So we stretch the front, we strengthen the back. A standing exercise that you could do to strengthen the back could be as simple as squeeze your butt and relax, and squeeze and relax. So you can hold on to something for balance if you need, but you're squeezing and trying to push your hips forward. Relax. Squeeze, hold for a few seconds, relax. Seated exercises for our core. The number one always is bracing. If you get any exercises from today, the one that you should remember is bracing. It has other names. The muscle that we're strengthening when we're doing this bracing exercise is the transverse abdominis, or the TA. So you might see other names for this exercise like TA activation or transverse abdominis strengthening. It's all the same thing. And what that means is we're strengthening the deepest abdominal layer. So if we think of our core, if we were to take all of our belly muscles away, everything, take it away, the deepest layer is this TA, the transverse abdominis muscle that runs from our belly, and it comes all the way and attaches to our back as well. So I'm going to share with you how to strengthen that muscle. Before I do that, I just want to share the other exercises that we're going to get into. If you remember, for core, we talked about it not just being our belly muscles, but also being our side, our back, and our hips. The exercises that we just did with the standing, those are all for our glutes, for our hip muscles. And then the bracing is going to be the one for the front of our body. Okay, so for the bracing exercise, it's going to be easiest to do this if you get into a tall position, your best posture, and then sit supported by the back of your chair. So you can be a little bit reclined. And what you're going to do is use your belly muscles to flatten the arch of your back, or wherever your arch would normally be. Flatten your arch into the chair and then relax. So it's a little hard to see with this in the way. I don't know if that helps at all. But if you imagine, if I really try to exaggerate my back, this is where the arch of my back is. I'm trying to flatten it using my core muscles, using my belly muscles. I'm flattening it and hold, and then relax. And flatten, and you're trying to make sure that there's no space, that someone would not be able to put their hand or fingers through your low back into the chair, and relax. I'm only having my arms up here so you can see what's going on, but if you're doing it, your arms can just be relaxed wherever you want. It's a challenging exercise to teach because it's such a small movement. You might not see any movement happening, but when you're the one doing it, what you should feel is engagement of muscles somewhere below your belly button and horizontally. So anywhere in this region would work. So again, you're just flattening your back and then relax. Another way that you can think of this is to use your belly muscles, your abdomen muscles, to pull your belly button in towards your spine. For some people, that makes more sense. And then you relax. Another way you can think about it that helps other people is think about pulling your belly button in towards your spine and then up towards your nose. Almost like you're zipping up your abdomen. So if you're wearing jeans, you're zipping up, you're pulling up and in, and then relax. All of these are just different ways to think of the same movement. So regardless of which way helps you understand what it is, ideally what you'd be feeling is somewhere down here. With that said, 50% of the time, if not more, like 75% of the time, even if you understand what to do, you might not be feeling it, and that's okay. That is completely normal if you haven't used this muscle in a long time. So for the majority of my patients who understand what I'm telling them and they're trying to do it, but they're just not feeling it, it can take anywhere from about 4 to 6 weeks of practicing this exercise daily before they finally have that thought of, okay, I think I know what she's talking about. I think this is what I was supposed to be feeling back when she told me to do this. So it can take a while, but that bracing exercise would then be progressed by, instead of sitting back here and doing it, we'd sit at the edge of our chair and we'd brace. We'd pull our belly in. And so you'd practice it there and then brace and relax. Then you would progress it, and this would be weeks later, if not months later, standing, and try to brace when you're standing. You're pulling those muscles in and relax and brace and relax. And the final way to progress this exercise is to do it in action. So if you want to practice picking something up off the floor, you'd brace and then bend down, up, and then let the brace go. Brace, pull that belly in, bend down, up, and then let it go. So you would brace while you're doing activities. Okay, so that's the best exercise I could ever give you for having a stronger core, better balance from a stronger core, reduced low back pain. But as I talked about, there are other areas of our core as well. One way, another exercise you can do from a seated position to activate the front of your core would be to relax back. Try your best not to use your arms from your armrest as you pull to a tall sitting position, and then slowly relax and fully sit back down, and then pull to a tall seated position. If this feels too easy, first and foremost, go slower. The slower, the harder. If it's still too easy, you can scoot more towards the edge of your chair so there's a bigger distance that you have to sit down. So you're relaxed, pull yourself up, slowly relax. So this is also for the front side of our core. Let me just say that, especially if you haven't been doing the bracing exercise, maybe all this is new to you. I don't know how it seemed when I was sharing it with you, if it seemed simple or not, but it is hard. It not only is hard to get the right muscle to activate, but it's hard to think about activating it and to associate that focusing with it actually happening and then holding that while you're moving. So just to give you an average timeline, even when MS was not involved, if I was treating someone without MS and going through that progression where we focused on the seated bracing and then sitting away from the back of our chair, bracing, and then standing and then moving while bracing, that would take months. Then when you and I would say maybe 3 months, if not longer. Then you add MS on top of that, that's easily could double it. It could be 6 months before you're feeling comfortable and confident to brace while you're going to move or while you're going to pick something up from the ground. So it takes a long time, or it can take a long time. And if you don't remember every time, that's fine. Another big component of bracing before movement is remembering. Even if you have full strength, you have to remember to do it. And you're not going to remember 100% of the time, and that's fine. Sometimes, at least in my case, I forget until I feel my back having pain. I'm like, oh shoot, I was supposed to brace my core. So sometimes that does happen too, but it is that combo of remembering and strengthening. And ideally it happens more times than not, but you will forget sometimes, and that's okay.